Jacob Johnson joins us this morning from Marble City Pharmacy. And Jake, good morning to you, sir. Good to have you aboard on this beautiful start to a Monday morning, right?
Well, I don't know. Was it beautiful? It was dark when I came in.
Oh, yes, okay.
It might be beautiful today.
Time change to do that every day.
Who knows?
I've heard this term, word, and really don't know that much about it. Sepsis. What is this, and what are some of the symptoms of it?
Sepsis. It's not a word we use every day.
No.
It's not uncommon, but it's not something we just talk about openly all the time. So sepsis is an extremely serious condition. And sepsis is when, overly simple, when your body has an extreme over-response or overreaction to an infection. Mm-hmm. And so you start with a baseline infection, something any of us could get, can be any number of things, and we'll talk about that in a minute. And then your body over-responds, the cells react differently, and over the course of this infection then just extremely proliferating, that's a tough word, I always struggle with that.
Yeah,
proliferating in your body, you get this decrease in blood pressure, this decrease in blood flow, all these other responses in your body, these increased clotting all throughout your body, lots of different things happen. And when you're not getting the proper blood flow to your organs, and enough of it flowing to your organs, you see lots of symptoms all throughout the body, beyond the symptoms of just the infection. So with the infection, you're probably seeing fever and sweating and chills and all these things from being really sick. But without the proper blood flow to your organs, you're getting lightheaded, you're having thought changes, you're very confused, you're having trouble breathing, really fast, really shallow breathing. Just a lot of this. From head to toe, you're having symptoms that are hard to explain why, and they're not just something you do at the house. These are things happening, and you're being rushed to the hospital, and they're honestly fighting to keep you alive when it gets serious enough.
I guess what you're describing can mask a lot of different things, though. But sepsis is something that people have to deal with. What is the cause of this?
The scary thing is that technically, sepsis can be in anyone with any infection. So if you want to take that out to its extreme, I'm a healthy person. I could get a paper cut that gets a mild infection and end up septic.
Oh, wow.
Now, is that what happens? More often than not, no. I mean, don't be scared of the sheet of paper you're going to see later today. It's not going to give you sepsis. But that's the extreme example, though, that it can be anyone or any infection. Any type of infection, bacteria, virus, fungus, any type of infection you can have in your body can become septic. Things that it's more common with, that we would associate it with, however, lung infections like pneumonia, extreme urinary tract infections, especially in people that are elderly, have catheters, things like that. GI tract, stomach, you get a really bad stomach infection, obviously think about it's not the cleanest part of your body. And so you get an infection or a problem in there, it releases a lot of things in your body that can cause an extreme infection. Large-scale skin wounds and burns open you up to a lot of infection. And then last, if you've got a lot of, just lack of a nice word, tubes and hoses in you, if you've got IV lines you have to have for, in ports, chemotherapy, things like that, catheters, breathing tubes, nasogastric tubes for feeding, the more tubes and holes you got in you, the more likely an infection can enter and get out of hand.
Yeah, I've read stories of this happening at medical facilities where they're going through treatments and develop sepsis. So certainly that, but let's boil it down. You talked about you being a healthy gentleman, and you are, but who can get this?
Like I said, it could be anybody, but we talked about the most common infections. Now, what about the most common people that end up with it? You love it when we say this.
Oh, yeah.
Those over 65.
Oh, yeah.
So over 65 or infants, so either end of the spectrum. Anyone with a chronically decreased immune system, something as serious as HIV, but then on the other hand, something, you have cancer, you're going through chemotherapy where your immune system's down. Anybody with a decreased immune system. Anyone with chronic long-term diseases, especially diabetes and kidney diseases, those two really especially. And then last, and this is more common than you realize, people that have to be on chronic steroid use, corticosteroids, not I want to be a good baseball player steroids, but corticosteroids. So you got arthritis or something like that, you have to be on chronic steroids, really common.
So being in the funeral home industry, I've seen death certificates that cause of death, sepsis. So it can be deadly, I guess.
Very much so. So, you get, mild and severe, sepsis. Most people with mild sepsis recover, and let's be honest, recovery takes a while. But if you have a more severe sepsis, up to 40% are going to leave us.
Wow.
And that includes healthy people. I mean, just you get to that point, your body's responding so quickly and so efficiently, unfortunately, that 40% leave us, and so it is a very big deal. And even for those that recover, it greatly increases the risk of severe future infections. Your body is just. I liken it to someone who has been through a severe car wreck but lives through it. They have things the rest of their life. They're sore here, this hurts here, they limp here. That it just leaves a mark. It just leaves a mark because your body has been through its own internal war, and the worse it is, the more you have later. Even in making a full recovery, it just makes you more likely to struggle later with different things.
What about treatments, Jake?
The treatments for sepsis, they say, what are they? Yes. The treatments are yes. It's, a lot of times when somebody shows up at the hospital with what, appears to be and then is confirmed to be sepsis, we don't yet even know where the infection started or where you're carrying it. We just know you got it. And so we're throwing the antibiotics at you. We know you have an infection. We got to figure out what it is. We're throwing everything we can to start treating what we think the infection might be, and then we hone in, as time goes on, we get closer. But we've got to pump a lot of fluids to keep your volume up, to keep your pressure up. We have to use drugs called vasopressors that keep your blood pressure and your heart rate up and everything going. And then all these other conditions that are popping up, the clotting condition, we're treating them as they come. Whatever it happens to be, that's what we're going to treat. So a lot of different things. If it's a lung infection, heavy breathing tubes, oxygen ventilators, depending on how bad it is, to keep you oxygenated and breathing right. If it's a kidney infection, putting people on dialysis temporarily a lot of times. I mean, so they're bringing in every tube and machine and hose in that hospital, depending on what the infection is and where they can find out that it started, until they can get you. And a lot of times they got to do even surgery to cut out these pockets of infection or anything that might be infected. Just, it can be anything. I mean, you'll see, the infectious disease doctor or maybe the cardiologist or the pulmonary. They just have to send the team in there because it's everything.
What you're describing is something that happens to stronger people, to older people, and to infants. But what about prevention?
There's a lot that goes into prevention. Nothing specific for sepsis, but when you boil it down and think about it. So first, just simple infection awareness and cleanliness, washing your hands, keeping wounds clean, things like that. Sounds overly simple for something so severe, but it's a big deal. And then, this is going to sound like a shameless plug, and it is not. But keeping up with your vaccines, if, for instance, pneumonia is the most common infection to lead to sepsis, and if it's not most, it's close to the most common, pneumonia vaccines, obviously. So vaccines for diseases that are preventable, that are infections, are a big deal. Early treatment of infection. If something's wrong, hey, I got a burn or a scar on my hand, it's starting to look, hey, this is getting a little more red than I thought. Let's get infections treated early. Don't be a hero. Go to the doctor, get them treated. And not ignoring signs and symptoms if you do have an infection of other things that start to feel really wrong. Call your doctor. Again, don't be a hero. You get these things early. Mild sepsis stinks and you're sick for a while, but mild sepsis ain't going to get you.
We talk a lot about different diseases and how it can affect individuals, but this morning we have a particular reason of talking about sepsis, and it hit close to home.
I'm solo this morning. So we missed last month. If you are a loyal Daybreak watcher and even notice when Jared and I are here, most people don't notice it, it's okay. We weren't here this week last month because that weekend, Jared went in the hospital. And I just happened to be sick, nothing that severe. I just wasn't going to be here that morning, but Jared sent me a message Saturday afternoon.
Our ratings went down, by the way.
I meant to apologize for that. Formal letter of apology coming soon.
You.
He went in the hospital that Saturday evening, overnight, Sunday morning, and by midday Sunday was on a ventilator, and over the next couple of days, he was a lot closer to dying than we care to really think about. and has been in and out of the hospital ever since. And he's currently back in now. Honestly, we believe things will be okay, but like I said earlier, it's just a long road. It just takes a very long time. We're going into our 5th week at the store now, without him there, and be patient with us. We're down 50% of the ownership team and the management team, and so be patient with me. I'm working through it. And I've got a wonderful staff that does a great job covering for me being a little stressed and exhausted during this time. And so no, Jared's been sick for a month now. People that have heard keep coming in and asking and say they're praying for him, and to which I say thank you, and keep doing so. The threat of, hey, we're about to lose him, was over after a week or two. But
that's a long week or two, though, isn't it?
It was a long week or two.
Yeah.
But keep praying, because it's a recovery road. And Jared's upper 40s and bizarrely healthy. And so he was carrying some infection somewhere. Still don't know what it was originally. Probably never will. But he had something harboring that he was unaware of. And when he ended up getting the flu and got sick, and just that kind of lowered his immune system. And the next thing you know, he worked that Saturday. We closed at 12:30. He worked that Saturday and was fine, was talking about going to Auburn's basketball game that afternoon. And by that evening, he was in the hospital the next day on a ventilator.
You're talking about going south in a hurry.
I mean, quick.
Wow. So he's in the hospital now.
In the hospital currently.
But hopefully he'll be out in a day or two.
Yeah, should go home pretty soon.
And the recovery is probably going to be probably longer lasting than you probably think, though.
Yeah, and he'll be back at work eventually. We assume. It seems that seems to be the normal course. It's just going to be multiple more weeks before he's healthy enough to really come back and do anything.
It goes to show you, though, Jake, that anything can happen in our bodies at any time. And you mentioned, we don't need to be a hero.
Nope.
We need to get checked out, and Jared is living proof of that. He got 2 beautiful kids, and that are very close knit family, and certainly our prayers and thoughts are with Jared and the entire family. And when we talk about a disease like this, a sepsis, it's something that we really need to pay close attention to. If you've got something going on in your body that you're not sure of, what do they need to do?
It's when you're not sure, ask. Learning to just be okay, asking questions. I don't have to know everything. Ask your doctor. Ask us. Listen, I can't tell how many times a day people go, "Hey, look, does this look infected to you?" And listen, I'm not an expert at that, but sometimes I can go, "Ooh, that you need to go get that seen today." You just don't want to get things out of hand. Although our former pharmacist, Daniel, that many of you know, said this is an extreme way even for Jared to get to lay at home and watch March Madness. He's a huge basketball fan, but this is extreme even for him.
I probably wouldn't be this way to do it, but anyway, we appreciate you coming today. And Jacob Johnson from Marble City Pharmacy, keep Jared in your prayers and his family in your prayers. And he's in the hospital, but he is recovering. So it's going to be a long-term deal, looks like. So we certainly urge you to continue to pray for him, and pray for Jake and all the team at Marble City Pharmacy as they serve your family, as they've done for many years. And Jake, we appreciate you coming by this morning.
Thank you much.
That's going to wrap it up for us on Daybreak Live this morning. We thank you for joining us. Till next time, God bless you. God bless America. Stay safe, everyone.